Welcome, anatomy students, to one of my first few videos I think I've ever done with CPR. So hopefully I can demonstrate and explain some of this stuff to you. I'm sure you love my new hairstyle. I just got a haircut the other day, so we're going with a new look. So you can kind of open your notes up and follow along on your Chromebook if you'd like. I'm going to kind of do a little Reader's Digest version of it, but if you want to look, that would be awesome. So we're going to talk about choking first, which is about 3,000 deaths every year in the United States. And you guys probably remember last year we had Titus save Carl's life in the lunchroom doing the Heimlich maneuver. Very, very effective technique and one that anybody can do. So let's just go over a few things with how do I know if someone's choking or not, and what do I do in response to that. So one of the first things you look for is a person's grabbing their throat. Doesn't mean someone missed a free throw in March Madness, which is March Sadness this year since we're not having it, but it doesn't mean someone choked off the game. It means someone's truly choking. So what we have, a little anatomy lesson, we have two pipes that run down our throat. One's the trachea and one's the esophagus. And we have a little flap called the epiglottis that opens and closes. I may show you that diagram when you come back to class Wednesday. But and sometimes that flap doesn't shut fast enough, and food literally gets lodged at the top of the trachea and shuts off your airway. And now we have a life and death situation occurring, and the Heimlich maneuver is going to basically squeeze all the air out of your lungs and expel whatever object is in there out, and it literally flies out. I've done this on my niece one time. I did this on my brother one time, and it's very, very effective. About two abdominal thrusts, and it came out. So they're grabbing their throat. You're going to ask them two very basic questions. Are you choking? They're probably not going to answer you. They're probably just going to shake their head. If they can't answer you, then that just simply means that they still have an airway. Okay. If they're barely whispering or they can't get sound out, and they're grabbing their throat, they may be turning blue around the lips. That's basically, it's a serious situation. So are you choking? Can you speak? That's the two basic questions you ask. You don't want to give them a real detailed response. And if they're not doing either one of those, then we're going to do the Heimlich maneuver. So the Heimlich maneuver is very, very simple. What you're going to do is make a fist with whatever strong hand you want. If you're left hand or right hand, doesn't matter. You make a fist. The thumb side is going to go just above the belly button. So you're going to take that thumb side of your strong hand, you're going to go right above the belly button, and then you're going to take your other hand and grab your wrist, and you're going to pull that person towards you and up. And you can see what it's doing to that person. It's expelling that air, and that object's going to go fly out. You do as many of these as you can until either one of two things happen. Either the object comes out or person goes unconscious. If they go unconscious, you're going to lower them to the floor and you're going to do CPR on them, which we'll talk about later. Okay. What if this person's really big? I'm not being mean, but they're really a big person, or they're 9 months pregnant, or a lady that's 9 months pregnant. Obviously, we don't want to do this. So what we do instead is we go underneath the armpits. We're going to make a fist, same way. We're going to go right between the nipple line, right here in the sternum, to the thumb side in, and we're going to do what we call a chest thrust. So it's still effective, not maybe as effective, but will work if a person's really big or they're 9 months pregnant. So very, very effective technique either way. Same deal, either the person goes unconscious or the object comes out. Okay. So that's the Heimlich maneuver. Kind of interesting story. Dr. Heimlich, who's in his 80s now, I believe, has went all over the world teaching this technique that he came up with years ago, and never did it on a person until he's in an assisted living facility right now, and he did it on a lady in the lunchroom just a few years ago. So kind of an interesting story. So that's a Heimlich. If the person's tiny or smaller, you may have to get on your knees to do this, but you still can do a abdominal thrust on a 6-year-old or 8-year-old or whatever age it might be. Okay. Now, what is different, let me switch people here, is a baby. Obviously, a baby, you don't want to do this. You'll crush everything that they have. So with a baby, what you're going to do is you're going to make a C with your hand. You're going to come up underneath their chin and their jaw. You're not going to palm them like LeBron James. That kind of defeats the purpose. You're clogging up the airway. You come underneath so their airway's open. You're going to lay them on your arm. Some people put them on their strong arm. Some people put them on their off arm, whatever's comfortable for you. You want their butt higher than their head. So butt higher than the head, so let gravity help you. You're going to take the heel of your other hand. It's going to feel weird, especially if it's your off hand, and you're going to strike them between the shoulder blades. Fairly hard. That's why you got to grip their head and neck. Okay, not patty caking. We got to get that object out. So we do 5 of those. Those are 5 back blows. If that doesn't work, we turn them over. We take 2 fingers, either your middle 2 or your first 2, and you're going to do 5 what we call chest thrusts, right between the nipple line, and that's what you do CPR as well, and that's going to allow you to get that object out. Same deal. I know the notes say do 5 and 5, and you do that, you alternate, but there's no set number how many you do for a total number. You keep going until the object comes out, they start crying, or they go unconscious. One of those 2 things is going to happen. This is going to be intense on a baby this size, but you got to get that object out. Okay. Now, the one thing that is different in your notes is it says on an adult you do 5 chest thrusts on a pregnant lady. There's nothing magical about 5. You do as many as it takes to either get that object out or they go unconscious. So there's no magical number with 5, even though the notes say that. We've been arguing with our supervisor for years that that's kind of crazy, but that's pretty much where we're at with that. Okay, so that's a Heimlich, or what we call foreign body airway obstruction. That's the fancy name for it. There's more stuff in your notes that goes in a little more detail, but that's pretty much the technique. And I'm going to tell you right now, you probably will not use this, or you probably will not do CPR on somebody. Hope you don't have to, but you may somewhere in your lifetime you may do the Heimlich. It's a little more common of a thing, people choking and getting stuff in their airway, especially if you think about our lunchroom and how fast kids eat, how fast adults eat sometimes. It's a very real possibility. Okay. All right, so let's kind of go over CPR. And again, if you kind of go to your notes where the CPR stuff's at, and I'll go through pretty much the basic technique of that, and then a video on Thursday I'll show you how to use the AED machine, and we'll kind of highlight that a little bit. But let's talk about CPR. So CPR, what you're looking for, I guess, is we talked about heart attack yesterday. What we're looking for is someone who is unconscious laying on the floor. They have no heartbeat. They have no heart rhythm. You don't have to check pulse because 50% of the time people don't do it correctly, so we don't teach that anymore. Not like a heart attack. You can't ask that person questions. They are laying there. Okay. Now, here's what's crazy. We want you to take only 10 seconds to assess if they need CPR or not. I know that that's fast, and that's going to cause you a little bit of stress, maybe a little bit, thinking how fast we have to do that. But it's something that we put in there because people are taking too long. And remember, yesterday we talked about how you only got 4 to 6 minutes to keep the brain alive. So that's basically where we're at with the 10-second rule. What we're looking for is we do something called look, listen, and feel. Okay, we're looking to see if they got any chest coming up or down. We're listening for breath sounds. So we're going to get down there, excuse me, and see if they got any breath sounds. And we're looking for any kind of movement, any signs of life. So what you're going to do, so let me get a CPR prompt out here, and I'll kind of show you this a little bit. Maybe I'll scoot this a little bit closer and adjust the camera just a little bit so you can see a little better. You don't need to see my ugly mug anyway. So we have this person laying here. They're pretty much lifeless. I had a CPR instructor one time tell me, our question always is, am I going to be sure that they don't need CPR? Because you may crack some ribs doing this process and that type of thing. And every time I've had people, CPR, EMTs, nurses, that type of thing, tell me, oh no, you'll know if they're lifeless. So I've done all that. I tap them on the collarbone, and I scream at them, are you okay? And I yell at them. Okay, this is part of your checkoff. If you look at your checkoff list, we're going to get down here. We're going to look, listen, and feel. Do I hear any breath sounds? Do I see their chest coming up? They're pretty much lifeless. And I apologize for any English teachers out there when I say this next thing. But people worry, oh, I don't want to do it incorrectly. I don't want to crack ribs. I don't want to hurt that person. If this person has no heart rhythm, they are technically dead. I apologize for the English people. You're not going to make them more deader. So you want to go ahead and do something to help them. So I've done all that I need to. Okay. Now, if I'm putting breaths into them, which we're not going to have to check you off on, I'm just going to show you how to do compressions. But I'm going to show you anyway because if this is a person I know, or I have a barrier device, which I'll show you in class tomorrow. I'm going to do a head tilt chin lift if they have no head or neck injury. So you can see how their neck comes up. I'm going to put my hand over their forehead. I'm going to put a barrier device on them. If I have one, if I don't, I'm going to breathe into them. Make sure their nose is pinched. I put a breath in, their chest comes up, falls back in. I put a second breath into them, and it comes up and goes down. Then I'm going to do chest compressions. So 2 breaths. And then, or if I don't know this person, they got blood all over them, I don't have a barrier device, then I'm just going to do right straight to chest compressions. You're going to take the heel, whatever's your strong hand. You're going to find your reference point, which is the nipple line. You can see it on this person, right between the nipple line. These guys have this nice indentation because we've done so much CPR on them. You won't have that on a real person. So you're going to put it right between them. You don't want to go too low on the sternum. This is called the xiphoid process down here at the tip of it. You might break that off if you're not careful. And you don't want to go too high because we got the collarbone on the way. Right? So we're going to take that heel of that hand, put it right between the nipple line. I would take my second hand. I like to lock my fingers. You don't have to, but that keeps you from sliding off your landmark. So I put that there. You want to make sure your elbows and arms are looking straight down. You do not have to straddle the victim like you see in Hollywood. Just go off the side. And I want to make sure my arms do not bend. I want to keep them locked in. I want to be looking straight down, and I want to push straight down. You can hear it click. And you got to go down 2 inches on a CPR or on a person to get effective chest compressions. Now, here's where the nice controversy comes in. So it's pretty easy technique, okay? You're going to go straight down, and you got to make sure that the chest springs back between each chest compression, okay? I know that in the your notes and in CPR manuals that we give out, it says you need to do 100 compressions to 120 a minute. You do the math. That's a compression and a half. That's a compression every second and a half. That is physically impossible. So we have argued with our instructors for years. Why are we putting that number in there? We can't attain it. It's crazy. But that's basically where we're at right now with that. You're not going to get that because you got to let the chest come up. You can do that, but it looks like a machine gun, and you don't want to go that fast. You want to make sure what we're doing is pumping blood to the brain. If we go too fast, it doesn't get to the brain. Okay, so or we do it too slow, it doesn't get to the brain. So we got to do effective chest compressions, and we do 30 of those. So 2 breaths and 30. If you're not putting breaths in, you do 30. You catch your breath and you do 30 more. That is called a cycle. Okay, and you just keep going until you can't go any longer. If you have someone in the crowd that also can do CPR, switch off on them every 2 minutes. So do it for 2 minutes, then the other person comes in, does it for 2 minutes. You just keep going until 1 of 2 things happen. Either the EMTs get there or the AED gets there. And then you will stop compressions and hook them up and use the AED. So that's basically how you do CPR in an adult. A child, which is 1 to puberty, another funny story. What is puberty? Good question. I've seen 12-year-olds that look like they're 30 and 12-year-olds that look like they're 4. So go by body size. If it looks like an adult, do adult CPR. If it's a 4-year-old, do child CPR. And the only difference is instead of using 2 hands, you will use 1 hand because you only got to go down about 1/3 the depth of the chest. Their chest has more forgiveness to it. And that's basically the only difference between child CPR and adult CPR. Okay. Now, with a baby, same thing. Everything's 30 and 2 breaths. Okay. With a baby, you obviously don't want to put a full breath into them. So if you're putting a breath into a baby, which you probably would, you just put a little cheekful, a little puff, and you're going to use 2 fingers, either your middle 2 or your first 2, and right between the nipple line, same deal. And you do chest compressions with your fingers because, again, you don't have to go down as far on a baby as you do an adult victim. So you have to kind of use your judgment. So really, that's basically CPR. It's, again, not a difficult thing to do. The Heimlich maneuver is not a difficult thing to do. I told you this yesterday, and I want to emphasize again today. You just have to have the confidence that you can handle this situation if you have to. Nobody wants to do this. Not even people that are trained to do it for a living want to do CPR. It's a very intense very stressful thing we have to do. But that's basically, we got to do what we have to do. And if I'm the only person there, and 70% of these cases are happening outside the home, we got to be able to jump in there and do what we have to do. So hopefully that helps. There are some other videos on there you can look at as well. It shows you the technique. There's a funny one with the dogs, and the guy's doing CPR and the dogs never move. That's fine too. But I'm hoping that helps you. I know it's a little bit different. We're living in kind of a crazy time right now, so we got to be creative with some of these things. So I hope that helps. So just kind of watch that video and come back with questions Wednesday. Just let me know if you've watched it, and we're going to call it good. We're not going to do any other assignment with it right now. I just wanted to show you the techniques, and hopefully that helps you understand how to do CPR, but have the confidence that you can do this, okay? And we'll kind of go over some more stuff tomorrow, hopefully, and then Thursday I'll show you another video on the AED machine, and maybe Friday we can get these CPR prompts out. We'll practice some of this stuff and and check you off. Our check-offs is kind of something new. We have something called a feedback, and this guy is very realistic, and what's nice about it is it's got these little lights that light up. I don't know if you can see them lighting up there. That tells you, the one light tells you if you've gone the right depth. I think it lights up. There we go. So if you go the right depth, it will turn green. And if you go the right compression rhythm, it's called correct rate, then that's basically what we'll do. So when you feel confident, we'll get you out. We'll put you on this guy, and we'll see if you can show me that you can demonstrate how to do it. And you guys will all pass, and we'll get your cards, and we'll call it good. So, hey, have a great rest of your Tuesday, and stay safe out there. And we'll hopefully see you again tomorrow, and we'll go over a few more things and get this in, because of all the stuff I teach. I told you this yesterday. This is one of the most important. So stay safe out there, and we'll see you down the road. Thank you.